Listeners, imagine a bustling hospital ward with the relentless rhythm of medical machines and the perpetual hustle of healthcare providers. Doctors running here and around, and surgeons running in out of the OT every now and then. And do they even get time to take care of their own wellness or their own health? That's a question, and today we are gonna deep dive into finding answers to it. Welcome to We Are Listening. I'm Pulkit Garg, your host for today, and we are here as your century of insight into bridging the gaps between wellness seekers and wellness providers. And today, as already shared, we embark on a transformative exploration of health and wellness tailored specifically for medical practitioners. And today we have joining us Dr. Diana Landiono, a beacon of inspiration in the medical community and here to shed light on a path often neglected in the pursuit of healing. Welcome, Dr. Diana.
Thank you so much for having me. It's a pleasure to be here. Thank you so much.
We are glad to have you, Dr. Diana, on this podcast. Before we begin, why don't you share with our listeners your journey so far and a brief intro about yourself?
Yes, thank you. I'm a urologist, a surgeon in Los Angeles, and that is my primary day job. But I'm also passionate about physician wellness, and really just trying to get physicians to realize they matter, they're worth it, they're important, and that their self-care, their wellness is essential and crucial to take care of other people. And we know that this is a phenomenon globally, not only in the United States. The rates of physician burnout and depression, anxiety, and physicians are lost by suicide yearly. So at least in the US, it's about 400 per year every year, and likely underestimated. And so this really matters because it affects the person that's suffering, the family, the community, and all the patients that they treat. And this is usually thousands of people. So it really does matter that we take care of ourselves and we find ways and tools to do so.
That's amazing. And it really left me out of words when you mentioned that we are losing around 400 practitioners every year to suicides because of stress or medical workplace. And this brings me to my very first question, doctor. As a medical practitioner, how you yourself navigate the intricate balance between caring for others and prioritizing your own mental health or general well-being.
Yeah, I think this is something that we're not taught, unfortunately. I mean, we're taught, how to take care of everybody else, how to diagnose, and what medications to give, what treatments, what therapies, all the things we have to do for other people. But we are never really taught that our own wellness is a priority. And it really is not taught because the training really puts our wellness sort of on the sideline. We do through training where our own sort of basic needs are really, again, put to the sides. So whether it's a break to eat, a break to pee, sleep, it just seems like something that you're going to do when you die. But, sleep is so essential for feeling well, for not starting to feel depressed from lack of sleep, start ruminating, just feel fatigued, angry, reactive. And that's essential. And again, that's usually something that, oh, well, you just stay up until it's all done, and you get up in the morning after sleeping 3 hours and you're up all night because you're on call, and there's no sort of system where if you're going to be up all night, there'll be rest for you in the morning. So it's just keep going, keep going, keep going, like you're a robot or your machine, but we're not. And then we start feeling all these symptoms, which are symptoms of a dysfunctional system. They're symptoms that are really saying we're actually having a normal response to an abnormal environment that does not protect those basic needs. So it's crucial to realize that when you are feeling something like that, there's nothing wrong with you. You're having a normal response to this abnormal, work environment or stressors or, all the strains that are put on us. So when you step back and you don't make it mean anything about yourself and realize it is sort of the system, then you just have to realize, well, we have to make some changes to prioritize, your sleep, prioritize, the time that you eat. And that may mean that you have to put boundaries. And that's something also we're not taught, but boundaries are essential to be able to have the time to do all these things that I just discussed. So boundaries again are very, very important. They're not taught, in any profession really, but it is really crucial as a physician so that you can have that time. You're not overwhelmed, overrun by so many things you have to do, or, things are put on you, and have that time for yourself.
Doctor, I was recently reading autobiography, I would say, by Paul, When Breath Becomes Air, and in that we hear the story of Paul Kalanithi, who is one of the neurosurgeons out based out of the US. And even during his journey where he was diagnosed with cancer and in his battle with cancer, the only thing that's really on top of his mind is how do I go back to the hospital and take care of my patients who are waiting for me to be treated by me. And even during the pain that he was enduring on his own without even making a sweat out there, he was worried about his patients. So this brings me to understand from you, what are the top 5 challenges that medical practitioners face at the workplace?
Well, it's probably perhaps, this depends, globally where you're located, but I think for at least the United States, we no longer have just a patient-doctor relationship. There's so many other factors that dictate how we take care of people. And what I mean by that is, for example, if I'm going to prescribe a medication that I know is the best medication because of their side effects it can cause a patient, or their interactions with their medications, or their age, and there's some contraindications, I basically look at this is the best medication. And of course, that's, most of the time is not going to get approved. It's going to get rejected. They're going to be told by the insurance company, you must try this 1, 2, 3 other medications first before we can consider approval of the other, which we know the other ones could be harmful, actually, could have bad side effects for somebody that's elderly, could cause them, let's say, memory problems, balance problems, falls, constipation, which are already problems for elderly people. So then we are going to have to be forced to give this in order for the medication we want to give to get approved. So what does that cause in us? That causes moral injury, that we know that is not beneficial, that it also is frustrating that they have to wait 2 more months until they actually get relief of the symptoms they came to see you. So we are no longer just treating with our medical knowledge a patient. It is dictated by other outside forces and greed and money. So we have to realize that's happening on a daily basis. Then apart from prescriptions, like what we're trying to give for the best care, we may order a test that we know is needed or is urgent, or we want to get it at this facility, which has a better rate of giving the best answer for this, procedure we want to do. And again, this is also denied, or we have to go through this lengthy process in the United States called a prior authorization. That means you have to set up a time, call somebody, hopefully a physician, but not always, to discuss why this test is needed and hope that it's approved, which is taking a lot of time out of your busy day to do this when you don't have the time already.
Yep.
So again, then that's a challenge, because when are you going to find it? Then it gets denied. And what do you do with the patients when their care is being denied? So that adds a layer to our frustration or challenges. You could also, think that, every year, let's say for Medicare, which is the biggest, insurer for elderly people in the United States, our reimbursement gets cut. And it was just cut even more this year. And then what happens? Well, how are you going to pay for the overhead, which you already have to have so many staff to help you with these authorizations, rejections, phone calls, billing, coding, all the stuff. So, you're getting less reimbursement. You have to hire a world of people to do all the other jobs. And, then you feel crunch, like how will you make the numbers, and the time starts getting smaller and smaller that you see patients. So we get about 15 minutes usually for a follow-up patient, which of those 15 minutes, you have to realize they are also getting checked in, they're getting their vitals, maybe they're getting to the restroom to give you a sample of urine, they are getting their medications checked, and all the checklists they have to do on the computer, again, is leading probably 5 true minutes of face-to-face time. very challenging to do good care in 5 minutes. So again, we're no longer just having a conversation with patients where we can really listen, examine, discuss, and give them the right medication or give them a test that's going to get approved. So we have all these constraints that are happening. And then, again, this is adding to our moral injury that we know we're likely not providing the best care, but we're just in survival mode. And another challenge would be that, for example, our documentation, before we could just sort of write on the paper quickly, just to document the medical part that is necessary and move on. Now there's like, click this, click that, make sure you address this thing, and now they change the computer system. So now there's a new thing you have to add. So we're spending just more time being transcribers and, really secretaries doing paperwork than truly taking care of patients. And sadly, many times I spend more time on the computer, writing orders, putting the medications, putting all the documentation than I do face-to-face. That's pretty sad. So again, there's many challenges where we're no longer truly taking care of a patient, but we're doing all these other things that take time away from the actual patient. So it's frustrating for us, it's frustrating for patients because obviously they feel it. And then they feel, that level of stress we're carrying, that burden, that weight on our shoulders, that fatigue from doing all this, and they feel it in those 7 minutes that we get with them. So all these stressors lead to chronic unmanaged stress, which is really what burnout is. So when we're spending all this time doing this, we're tired, we're fatigued, and we're not leaving at a normal decent hour to go home. We're still finishing paperwork, we're finishing notes. So again, your day gets longer, then you get home and it's like, well, when are you going to find that time to do those things that are good for your wellness? Spending time with people, exercising, finding time to, cook or eat healthy meals and not just takeout or something fast, and sleeping, those minimum of 7 to 8 hours per night. So all those things for, your own wellness start just coming out of the equation. And we're looking at, well, what's happening now. It's, burnout, anxiety, depression, feeling overwhelmed, then we're overweight, then we're having our own medical problems. And if you do get, an illness like you described in that book or any physician, it's like trying to manage when are we going to have those appointments to take care of ourselves and that treatment.
Dr. Anna, I would like to understand, you mentioned about building boundaries and for taking care of oneself out there. And it's a very subjective question when I'm putting it across, I understand that. But as a doctor, don't you often find yourself in a dilemma of living up to the oath that you take as a doctor versus building those boundaries for your own healthcare? How do you really navigate this path?
Yeah, I mean, it really is changing the mindset of how you look at putting a boundary, because it really is the most loving thing you can do for yourself and others. If you don't put a boundary and take care of yourself, and then you're feeling like angry, depleted, frustrated because maybe you added that extra patient very close to your lunchtime and you're not going to get to have lunch, and you're going to be, angry and also just annoyed at the patient you added, plus the whole day after because you didn't get to eat, then you're really not giving any good care to anybody. So, and they're going to feel that, of course. So to say that, putting your needs last is the important thing as a physician to take care of others, it's really false, because you really cannot take good care of people when you're, feeling that way. So it is important to make time for yourself and to realize we're human and we have needs, and we're not like, again, these robots that can just go on and on and on and on without taking care of ourselves. And initially there may be some resistance from other people or even patients feeling like, why can't you see me at 12:10 when your lunch is at 12? Well, because I can't, and it's just what it is, because I have to have a break too. And I think sometimes when you just explain that, I need to have lunch, I want to take care of you, but I need to eat, most people understand. And if they don't, I mean, then that may be not a good fit, perhaps as a patient, because they need to realize, like, again, we are human, we have to take care of ourselves. So sometimes there is resistance from other people, especially if anybody, not saying patients, but just anybody, especially if they're narcissists, they really like to put up a fight when you make boundaries. But boundaries are essential for for anybody, and especially if people around you may be narcissists, they need to have that boundary and you need to stick firmly to it. Just like, if you have little kids, you tell them to do something, you have to stick firmly to saying, we don't do this, otherwise it's just going to be chaos.
And another, point I would like to discuss with you is around doctors being really oblivious to the symptoms that their body is showing. Often, disease or an ailment might be glaring them in the face with the symptoms becoming really profound. But they're like, okay, we are doctor, we will just pop in a crocin or Disprin. Like these are some of the prominent medicines that doctors or even individuals take in India. I'm not sure of the US market out there, but it is just they are sort of being oblivious. They're not paying attention to the symptoms, which they very carefully and with they take time to explain to their patients. So, what are your thoughts around this?
Yeah, that comes from just being disconnected to your body and your needs. So, first of all, always kind of thinking. We're always in our head, and we lose sight that we also have a body connected to our head, and that it is giving us those signals, those warning signs that something is not right. But again, we just forget it. We just stay in our head, forget that we have a body, and not really feel what's going on. Like, oh, maybe this ache or pain is a symptom of something. And we just neglect it again because our training told us there's no time to stop and rest and feel something. We are just going to keep doing, thinking, and forget about feeling. So we sort of get disconnected from that wisdom of our body, and we just stay up here and forget the body that is telling us this such important information. So again, when you're go, survival, go, run, you don't stop and pause and feel what is happening in your body. And then even when you do feel it, again, we are trained that, we just keep going. Even if you feel that pain and we are limping or we feel sick or we're exhausted, we just keep going. Again, because we are taught somehow that taking care of ourselves is some sort of weakness, that we're just not good enough or tough enough for the job. And again, it's this false belief that has been ingrained. So, sadly, it's just sort of changing the narrative that we are important, we matter, we need to take care of ourselves. Just going back to the first point, we really do matter, we are important, and we need to take care of ourselves. And it's just, again, reframing what we have been taught and understanding the belief and the premise that we matter.